with many patients of color that I work with who may have histories of complex trauma, maybe borderline personality disorder, like most treatments, right, there's a emphasis on maintaining the safety of the treatment. Like some people call it developing a commitment to the therapy or having a treatment contract. So in working with many patients of color, especially patients of color who are darker skinned or black, there's a way in which a racial or skin tone difference between my client and I could kind of bubble up into the act of treatment contracting as such. So for example, there's a case that I wrote about a few years ago where this was a Afro-Latinx patient who had had a history of involvement with the police and being engaged in different forms of violence. And at the beginning of treatment, they very much expressed like they didn't want to get, caught up in those situations anymore. Like they wanted to continue getting better and moving towards change. But they also knew that when they felt really threatened, whether it was by somebody in the community or a cop, that it would really put them in a very fight and flight kind of place. So in our early conversations, I share with them that part of my goal is very much to help them reach this goal, right? But to also ensure that we're both around so that we can do this work together. And so I proposed to them that as part of our treatment, as part of the consensus we would need to do our work together, that they would try as much as possible, if there was some altercation, to avoid it, to leave the situation, and keep themselves safe, because we cannot do this work if they were physically harmed or even involved with the criminal justice system again. And they very much consented to that being a part of the treatment, because they knew that if they weren't held accountable in this sense and have something that could remind them to do that, then the likelihood of another incident occurring was very high. So with that contract in place, we then start doing our work, like processing different traumas, relationship dynamics, talking about the present, talking about the past. And as we're doing this, they start getting better, right? There's a greater sense of being able to trust people and being connected with others, engaging in some forms of work, like different indicators like treatment progressing. At different points, because there was this racial difference, like even though I'm Puerto Rican, I'm a white Puerto Rican, my client was Afro-Latinx, so I would kind of broach the subject and wonder aloud sometimes, what is it like for him to work with me as somebody who, even though I'm Latinx, I'm also white? Could that have any relevance for our work together? And at first it was something that I often hear a lot, like, no, I have friends of every color, race, and creed, it's not an issue, etc. But then deeper into treatment, they started to bring up the fact that actually they had felt very constrained by our treatment contract or treatment agreement. It almost felt like I had put cuffs in his hands, like literally tied his hands behind his back, and then I was kind of putting him in these chains that wouldn't allow him to fight back if he was in a situation where there was a confrontation. And that language, especially around chains, kind of tipped my ears a little bit. So we started to broach whether, again, that had something to do with our racial difference. And that kind of created an opening to talk about the fact that he felt, the fact that I did this to him meant that I was a sellout, I was a self-hating Puerto Rican, was basically white, very much part of the system, which in certain respects isn't wrong. Like, it's not wrong for him to say that my being a white Puerto Rican puts me in a certain position with respect to the society. That the fact that I asked him to engage in this treatment contract didn't in some respect make me an agent of this broader world that we live in that was oppressing and constraining him. And it was actually the fact of being able to allow that to be spoken, that we could talk together about these feelings that he had, about the treatment contract, about me as his therapist, etc. It is true that the treatment contract was very helpful in maintaining the treatment and establishing the conditions of safety to do our work. It is also true that it took on a racialized meaning. there was something else kind of sandwiched in between those two, which is that this was one of the first experiences he had had of being vulnerable with another man, and another man who was Latinx. And once we started articulating that piece of it, it became quite moving, because even though he was experiencing me as this kind of persecutory racial object, he was also experiencing me as a source of love and care, that I cared enough for his well-being to propose that contract in the first place. So you can see it's very complicated. Like, in a sense, he's relating to me as, a father he never had. He's also relating to me as a racial oppressor, right? As somebody from this kind of Creole, kind of light skin and white Latinx presentation. Like, all of that is in the mix. And it's being able to talk about all of that that then allows us to have a different experience and to imagine a different kind of world where he could be cared for, loved, and valued across a racial difference that could still be held together by, to be just kind of a little hokey, that could be held together by love in a world that makes love impossible and fraught, including across lines of racial difference.
Yeah, that's an amazing story. It is. You asked the question that I think is probably on the minds of anyone who's, when you're two different skin colors in the world we're living in, and you're engaging in that kind of an exchange, there's no way it can't be part of the question that's in each person's head, certainly in the treater's head, I would think.
Yeah, I often find that it's, it's almost kind of haunting in a way. Like, there are many patients that I might bring up, like, oh, I'm a white Puerto Rican, you're African American, you're Afro-Latinx, what have you. And that right away will lead to a conversation, right? Like, what does it mean for us to work together, et cetera. Yeah. But then for other clients, it even haunts the treatment even much longer than the example I just gave. Yeah. I had this client that I worked with who was also Afro-Latinx, where in the beginning of the treatment, they had a lot of substance use problems, self-harm. There was a lot of instability. And same thing, talking through their goals, like what they want, and talking through a treatment agreement and all that. And same thing, I raised the question, like, oh, I'm mindful that I'm a white Latinx person, you're Afro-Latinx, what does that mean? And same thing, like, I'm always floored when I get the, no, it doesn't matter, it's not relevant to me, and then later it just comes up. But in this case, what made it kind of interesting is that, we worked together for a number of years, doing the thing, like bringing in psychodynamic stuff, skills training, the whole nine, getting better, reduce their use, start to abstain, stopping self-harm, right, start getting better. As that's happening, they would periodically bring up, highly publicized cases of police violence and murder towards Black and brown people. And he would bring it up, and I would then, start to inquire, like, what's it like to share this story with me? What's it like to talk about this right now? I wonder what it means for us. Like, every variation of, an invitation to explore it would fall flat, and they would change the subject. And they did that over and over again over the course of years. And then, as I started having kind of different shifts in my thinking of how to work through this stuff, I started taking kind of a more, what I almost call kind of a more reserved approach when those things came up. And I would get very focused on language, like the specific words people would use that would kind of signal some theme related to like hierarchy, power, stuff like that. And I would just reflect the words back, literally all I did. Because I knew that if I tried to address it too directly, they would kind of pull it back.
Could you give me could you give an example, like the
language? I'm about to give you the example, because that's what led us to talk about it. So they were talking about a conflict they were having with a family member that they were now living with. And as they're talking about that conflict, and I should underscore, like, this was a treatment that we did in Spanish, so I'll try to translate some of the things that happened. when they were talking about this family member, what they were trying to say was, I love this person. So it would be in Spanish, yo amo a este familiar. I love this family member. But what happened was they stuttered. So in Spanish, what they said was, yo mi amo, yo mi amo, perdón, yo amo a mi miembro familiar. So in English it would be, I love my family member. The word amo has a kind of ambivalent meaning in Spanish. Amo can mean yo amo as in I love, but it can also mean mi amo as in my master. So it has this very complex meaning, and I'm struck by the fact that he kind of stumbled on that word and said two things simultaneously. I am my master, and I love this family member, right? If he had just said like, oh, I love my family member, I wouldn't thought twice about it. But the fact that they stuttered stood out to me. So I just reflected back the word, amo? He goes on to say, yeah, you know, like I love them so much that they have taken care of me. Like it makes me think back to growing up in their home country. You know, when we grew up in this big hacienda. Now, the thing about the word hacienda is that it can literally mean plantation. It could mean a big house. It could mean a farm. In that moment, again, I was just struck by the different meanings of this word. It kind of signaled a certain class position because you had to have some resources to have a really big house, but it also had this racial connotation, right? So again, I don't really raise any of that. I just reflect back the word. Hacienda. Oh, it was this big, beautiful hacienda, and then they, regale me with these stories of like, milking cows and raising chickens. Like it's very picturesque, right? And at one point, I just raised the question like, oh, like I wonder, growing up in your home country with your family, what social class was your family? And he replies, oh, well, they were middle and upper class. They were very class conscious. Like you had to do all the right things, and if you didn't, like if you picked the wrong spoon or you didn't dress the right way, he goes on to relate how if he kind of fell short of any kind of like standard of etiquette, he would get brutally just brutally beaten by this other family member who was kind of the patriarch of the family. And he's telling me these like really intense acts of violence. Like it was just trauma, just pretty brutal trauma. And it was so kind of a little dysregulating that I try to ground myself by just repeating back kind of what he started with, like if you didn't, right? So if you didn't follow this etiquette, this would happen. So I just reflected back, because if you didn't, and there was kind of a pause. And he says, well, because then you're a lower class. And he pauses. Well, and I guess, I guess it reminded him, kind of the patriarch, I guess it reminded him of like my father, who was no negro, pero oscurito. It reminded him of my father, who was not black, but a little black. Now, the diminutive form of many words in Spanish, in many different dialects in Latin America, like if I were to say to someone like, oh, I'll be right there, I'll say, voy ahora. If I say to them, voy ahorita, basically, like you're never seeing that person again, essentially. Like they're gonna be hella late, right? So the diminutive sometimes points to the opposite. So if I say, un poquito, like ahorita, it actually means like a whole lot. So the language was kind of telling, because he's basically saying in Spanish, my father, who was not black, just a little black, right? So you start to get the connotation. So when I hear that, I of course know what my patient looks like, and he's described his father as black, but not really black. And I don't know his mother, I never met her, so I don't know what she looks like, but it gives me this sense that he must be somewhere in this continuum. like in relation to his mother and his father, like where was he? So I just raised that as a question. And where were you? And he gets very emotional and starts to cry. That was the first time he had allowed himself to make a connection between the incredibly just brutal violence that he was subjected to by this patriarch and the color of his skin, which was closer to his father's than
You mean his mother's? You mean it was closer to his mother's?
No, it was closer to his father.
Oh,
because
okay.
the father was, not black, but a little black.
Okay, so
Right.
he wasn't light-skinned, is what he was saying.
Exactly.
Okay, I
exactly.
understand.
Like
Okay.
that's kind of a thing. It's kind of a thing in Latin America. Like people who might be very dark-skinned, very phenotypically black, saying, no, pero yo no soy negro.
Oh, interesting.
No, but I'm not black. I'm just, insert nomenclature here. Like, no, I'm not black. I'm trigueño.
I see.
Right?
Uh-huh.
Like, which means, can mean wheat-colored, but it also gets used for brown skin and black skin. So again, it's very complex. Like,
I see.
you can have dozens of, racial classifications, but they all circle around this one anxiety, which is to say that, you're not really black.
Got it.
Right.
I see.
So in this example, he was, basically playing down the fact that his father was, very dark skinned. And he was closer to his father than he was to his mother, who was actually much more Creole and light skinned. And so, there was just nothing he could do that was right, whether he picked the right spoon or not. So it was a sort of, very traumatic thing to get in touch with. Right? Mm-hmm. Like the logic of, if you do the right thing, you won't get beat. If you do the wrong thing, then you get beat. But what we kind of connected with is, like, it didn't matter what he did. This patriarch was going to be extremely violent and traumatizing because of the color of his skin.
Right, I see. And it sounds like in the therapy treatment, you could never quite get at it. And so you, as the clinician, sort of backed off, or sort of would use language as a sort of clue or hints.
Exactly.
To try to get inside of this thing that you felt was probably pertinent to this person's struggle, or something of their psychology, right? Right.
I mean, essentially, every time previously that he had tried to bring it up and then kind of pulled back, it's like a way of saying, is it safe for me to be black in this space with you? But wait, no, if we go into that, that would mean acknowledging there's this difference between us. And that's fundamentally unsafe to me because of these experiences I had. So it was both like wanting to name it, but then for us to actually talk about it would have been too dangerous. So in a way, using this other approach where I wasn't trying to so directly on the nose, like broach it, mm-hmm. but just create an environment where all of the associations that he had between all of these experiences and his experience of race could kind of almost bubble up a little more organically. Like, it's not me saying, oh, could this be about race? It's him feeling safe enough to kind of make those connections for himself, and then opening up for us to talk about it. And that was exactly the moment where it became possible for us to talk about it together. And I think if that hadn't happened, there would have been a whole other realm to their experience of trauma that would not have been talked about. We could have done all the DBT skills and talk about Dear Man and process your attachment and experiences, whatever. But then this fundamental, almost foundational layer of pain would have, just remained inarticulated.